Hello and welcome to the Trust Driven Podcast. Today is Trivia Day, where we strive to make medical research not just informational, but fun. I'm your host, Dr. Melanie Short, a chiropractor in Clarksville, Tennessee. I'd like to introduce our guests playing trivia today. First, we have our winner from last week, Dr. Ed Lera.
Hello, everybody.
He is a sports medicine specialist from Dallas, Texas. We also have Dr. Josh Satterlee, a chiropractic expert from Las Vegas, Nevada.
Howdy, howdy.
Again, playing this week, we have Dan Swinsko. He is a physical therapist from Scottsdale, Arizona.
Hello.
And new on the podcast this week, we have Christy Willis. She is a nurse and educator from Santa Clarita, California.
Hey.
Welcome, everybody, to another week of trivia. Today, we have a 6-question trivia quiz. It's based on the topic of patient communication. Our contestants will write their answer on a piece of paper and show it to the computer after the time is up. Contestants, you will get 1 minute per question. Discussion is allowed, but if you want to keep your answers secret, the winner will receive a donation towards the medical association of their choosing. Anybody have questions before we begin?
Let's go.
Let's go. Okay, so Christy's ready.
I'm ready to win.
Okay, Josh is going to win this week. Okay, so our first question is going to be coming to you from H.B. Beckman, and the article is called The Doctor-Patient Relationship and Malpractice, Lessons from Plaintiff Depositions. This is from the Archives of Internal Medicine Journal from 1994. Okay, so we're bringing it back a little bit, and I promise you this week I have much more, most of the questions are newer research. This one's a little bit...
Melanie, were you born in 94 yet?
You know, I was 4 years old. Can't say I remember it, but your first question, and I am starting your timer, is of the following 4 themes, so these themes are all presented within the article, which was the most frequent issue found in malpractice litigation transcripts? So your 4 themes are deserting, devaluing the patient and their family values, delivering information poorly, or failing to understand the patient and or family perspective. So all 4 of these were found within the depositions. So I'm going to read those to you again. Your question is, of the following 4 themes, which was the most frequent issue found in malpractice litigation transcripts? So A, deserting the patient was most frequent. B, devaluating the patient and or family values or views was most frequent. C, delivering information poorly was most frequent. Or D, failing to understand the patient or family perspective was most frequent issue found.
So all of these we know did occur, but just which one was the most frequent?
Yes.
Great.
Correct.
Yeah, they're all good answers.
Yeah.
Yeah.
They're all horrible patient care, but what's the most found?
Exactly.
And time. So we're going to go around the room. Let's see. Okay, Josh, I got you first. I got B for Josh. Christy chose C. Ed, we have D. And Dan also chose D. So now we reveal the answer. So it was A.
Oh, whoa. What?
Which has to be one of the worst, right?
That's wild.
Patients felt deserted. So, well, if you think about it.
Wait, they felt deserted or they actually were?
There's a lawsuit, Christy. What happened doesn't matter. What I feel like happened does matter, you know?
Well put.
Chrissy, that's actually a good question because I'd have to go back and, see the wording. Essentially how I saw it was people were most complaining or putting in malpractice lawsuits when they felt deserted is kind of how I saw it. If that kind of makes sense to you guys. I'm not sure how it came across to you.
Yeah,
The reason I put D is because similar research from maybe similar time was that the greatest factor for predicting who's most likely to be successful in rehab isn't the letters after your last name or this, that, and the other. It was the relationship between the patient and the clinician. And they used the term the patient therapist alliance or the treatment alliance, I think is what they called it. And so I thought D would be the opposite of that. That's why I chose D. But the relationship you have with your clientele not only will relate to your ability to have a better outcome, but also apparently prevent you from being sued.
Yeah, see, I answered B, like devaluing the patient or their family views, because I thought, like, if you're demeaning, if you're devaluing and all those things, even if you did the right procedure in my mind, which I thought A is you're not doing the right procedure, but B, you could do the right procedure but make you feel bad about it.
Yeah.
And I was like, oh, that would just piss people off, right? Which is why you'd enter a lawsuit. So anyways, just interesting. Yeah.
I was debating between C and D because we all know, our communication as healthcare providers, we are thinking on a different level and we're kind of 10 steps ahead. And sometimes, especially if we spend a lot of time with other healthcare providers, you forget that everybody doesn't communicate in the same way that you do. So patient education has been a huge push in healthcare field the last 15 years. But then D, also, I agree about that, patient alliance and feeling supported by your healthcare provider. You are going to have much better outcomes with that. So we were.
Well, you did say it's been a push in the last 15 years. This research, scary enough, is from 30 years ago. They sampled in 1994 is 30 years ago. But anyways.
Let's cruise on to question 2. I have a lot of newer research this week because I think we dove way into the archives last week. So I figured we'd pull out some new stuff. All right. So question number 2. The title of this article is "If Your Feelings Were Hurt, I'm Sorry. How Third-Year Medical Students Observe, Learn From, and Engage in Apologies." So this was written by Ian Fisher in the Journal of General Internal Medicine in 2021. So we're going to be talking about apologies here. So get you in the right mindset. All right. Your question is, when studying the 4 elements of an apology, it was found that what 2 elements were the most important in a sincere apology? So there are 4 elements. I have all of them listed here. You're going to be trying to pick the 2 that together were the most important. So A, acknowledgement and remorse. B, explanation and reparation. Or C, acknowledgement and reparation. So your 4 elements of an apology are the acknowledgement, explanation, remorse, and reparation. But which
So again, all of these
important?
4 all of these answers are correct. It's just which were the 2 most impactful out of these.
Yes.
Dang.
And forming a sincere apology.
See, here's what I'm going to do. Imagine what a politician would do and then choose the opposite. Yeah, that's right.
You're making me think of a show I watched one time where the person said something mean. You need to apologize. Like said, "You're stupid, Josh." "Dan, that's mean. Apologize to Josh." "Josh, I'm sorry, you're stupid."
Exactly.
All right, I'm going to start with Christy this time. So I got C for Christy. What did I see? A for Josh, C for Dan, and A for Ed. All right, well, you guys were on the same path here. Nobody chose B. So let's find out the answer was C.
Yay!
You can put it on the board. All right, so acknowledgement and coming up with a solution to the issue. So I think acknowledgement's a huge thing because so many people don't want to acknowledge that they did something
It's like
wrong.
those politicians, they're like talking around it and they're just not ever acknowledging, like, yes, I did this, they're just like, well, prayers are with the family and, we're hoping for this. It's like, yeah, just admit you freaking screwed up, dude. It's like not that big of a deal.
Right?
Yeah, and sometimes people use the explanation in place of an acknowledgement. Like, I don't need you to explain why you made that bad choice you made. Let's just acknowledge that it happened and let's move forward from it.
Don't I remember getting an email from someone in this group telling me that when I make a mistake and I acknowledge the mistake and then I crush the whole component of, oh my gosh, let me do this for you, let me do that for you, I apologize, I dropped the ball here. That's when you get a roaring fan because everybody makes mistakes, but not everybody owns up to it and then makes those reparations. Does that sound familiar to anybody?
Yeah, I read the same freaking newsletter. That's why I got it.
Where is this newsletter coming?
Does that
Yeah, that's
familiar
pretty incredible stuff.
at all?
Hmm?
Does that sound familiar to you at all?
I think we have another question coming up. Yeah. No, I'll explain this. This is what I think what you guys are referring to. There's another, and I hope to God it's not in this trivia podcast today, but there's another study that says the highest of any measure of patient satisfaction is where where the doctor makes a mistake, admits it, calls it out, and then fixes the situation. So, Christy, imagine you come in for a visit and I'm like, oh my gosh, Kathy, it's so good to see you. Oh, I'm so sorry. It's not Kathy. It's Christy. Oh, God, I'm so sorry. I saw so many people today, but I know it's Christy. I'll work on it in the future. Anyways, how are you doing? If you create that mistake, catch yourself, and then admit to it and fix it, that's the highest patient satisfaction you'll get. And so those people that ran that study decided, well, could you manipulate that? And they did. Like 2 years later, they did the same. They told doctors to make a small mistake and fix it. Like, you don't want to be like, well, looks like you have stage 4 cancer. Oh, sorry. It's actually pneumonia. My bad. Anyways, let's move on. But making those mistakes, calling it out, and then fixing yourself is like, it shows you're humble and you're a human.
Well, and it builds trust, right? Like this person's gonna acknowledge what's going on.
No matter what.
Yeah.
Right. But if they go like, oh, hey, Kathy, and you're like, it's Christy, whatever. So yeah, that one does not result in high. There's not high levels of trust and improvement there.
All right, how you guys feeling? We're ready? Number 3.
Well, who's on the board now? Because nobody got their first one right.
No, so I have Dan and Christy are on the board here.
All tied up with one.
Yeah.
All right.
1-1. Okay, so we're going to cruise on to number 3. The title of this article is called Revisiting Effective Communication Between Patients and Physicians. Cross-sectional questionnaire study comparing text-based electronic versus face-to-face communication. It was written by Tala Mirzali in the article of Medical Internet Research, which is an awesome journal. I didn't even know that we had, but medical internet research has to be interesting. This is from 2020.
I was going to say Dr. Google. It's like the journal everyone hates.
It's it's so interesting because they're looking at Medicare, like medical care from the internet, essentially, and like, are we actually getting good information? Like, is telemedicine actually working? Is it better than face-to-face? Is it, anyway, so I thought it was just kind of interesting that we have a journal that looks specifically at looking at electronically based communication versus a face-to-face visit.
I think it's great though, because we're all being forced into that more and more. Like, there's no way to avoid it. So
yeah. All right, so your question is, so this is true or false. 50-50 shot here, everybody. Patients perceived face-to-face communication to be more favorable medium than IT-mediated communication.
What year was this from?
2020.
Pre-COVID.
Well, yeah. This was
Well,
published
it
in May.
came out in
wasn't.
May, but yeah. So essentially this was done probably in 2018, 2019. But yeah, true or false, patients perceived face-to-face communication to be a more favorable medium than IT-mediated communication. What do you guys prefer? I mean, we're all like kind of hands-on practitioners, so I feel as though I prefer face-to-face, but...
Without question, I'm remarkable, just amazed at the success we have with our telehealth, though.
Yeah?
Yeah, it blows my mind. So many really cool stories of people getting better, so few visits, and all of them via telehealth. And, I want to think I've got these magic hands where all my manual therapy makes the biggest difference. But we've had some remarkable outcomes and some with complicated patients sometimes with just telehealth. It's remarkable.
That's awesome.
I work in a medically underserved area, and telehealth is great for me because a lot of my families don't have reliable transportation and there's language barriers. And so it's been wonderful in the community that I work in for like easy things.
Mm-hmm.
Yeah.
Cool. Your time is up, by the way.
All right.
Let's go through and see what we got. Josh says true. Ed says false. He's always got to be the opposite. Come on.
Mm-hmm.
Dan says true. Christy says true. All right. Well, let's see. It was true.
Gosh,
Yeah.
darn it. I'm going to
Ed.
But Ed, I can totally see that though, because like I interact, so being on a military base, and my husband and I are, older. He's and
Did you just
My
call
God.
yourself older?
My God.
on the
Older
military
than
base.
what?
Okay.
Exactly.
Older than enlisted soldiers can, they enlist at 18. They have wives at 18, 19 sometimes. So I interact with a lot of people that are, like half of my age sometimes. And a lot of them don't like face-to-face. Like they prefer to message you through Instagram or talk to you on Facebook, or like they're nervous to like pick up a phone and call somebody, or to do this, anything, like to have to come into an office to talk to somebody. So I can totally see where Ed was going with that too.
Yeah. I think you get an interesting, diverse answer based on decades of life.
Yes.
Yeah.
And I bet it'll change a lot in the next 10 years.
Without question.
Yeah.
Which is wild. My husband and I are always talking about that like, it's just, we're coming into the age where we're seeing like adults that have children that are significantly younger than us. And I'm like, what? They don't know this or they don't do that. And a lot of it has to do, I think, with technology.
Yeah.
Yeah. I did see something interesting, like looking at this, that Google was saying that 20% of people under the age of 25, it's common that their first interaction with a business is through an app, meaning like they'll message through Instagram DMs or TikTok or something. 20%, right? Whereas like if you told your parents like, hey, did you Instagram that plumber? They'd be like, what is Instagram and what are you even talking about? But they said a big factor in it in this article was that if you started dating through an app, you would never give out your phone number or your own email address. You would use like whatever the dating website's internal messaging is to keep yourself and your information safe. And then if you like got to a point where you trusted the person, you'd be like, all right, well, here's my actual phone number. So
it's very interesting perspective.
Yeah. So anyways.
Well, I will just say I fall into that category sometimes because I found my hair lady on Instagram and that's how she does appointments. You have to message her. There's no website. There's no phone number.
Same for my tattoo person.
Yeah.
Wow.
I saw a funny TikTok today and this lady was talking about, she said, my daughter sent this to me. She said, I was not on any online dating apps, but I realized like I can just meet a guy for coffee and then ask him to come fix my ceiling fan or whatever it is. And she was joking about this, but she's like, my friends were all saying that this is so dangerous. Like you're inviting some man that you don't know into your house. And she's like, but honestly, like what's a handyman? She's like, if I find somebody on this thing and I give him, and I can at least suss him out for an hour or two, or I just call up some random guy I've never seen before. He comes over. It's the same thing as the same strange guy in my house. And this way I'm doing it for free. And I was like, oh, good Lord. However, when you're talking about information security, we are interesting about that and who we share with and some like without even thinking about it. And then with other people, you're like, oh no, I can't tell you that.
Wow.
Well, it makes telehealth interesting too, because whether you do video or phone call or even text messaging, like my daughter's office texted me and was like a person, it wasn't automated. It was, can you send me like her social security? Can you send me the insurance card? Can you send me a picture of your driver's license? I'm like, I'm going to call.
Yep.
Or I'll bring that with me. But it was interesting to get like text messages from an office. Now it's great to have that like post visit or reminders leading up to a visit, but have the front desk staff was asking like personal information that I'm like, I don't feel quite comfortable texting that to you, but I'll call you about it.
I wonder, Dan, how your daughter would do it because she's 20, let's say 25. And then Christy has a 15-year-old. I wonder just to ask them, would you send them a photograph of your driving license?
Yeah, my kids have been hammered enough by your mother and I not to do that they would like, no way. I think they feel like there's a vulnerability to their what do you call it, their identity being stolen. So I don't think either one of them would do that. I hope not.
Yeah, interesting. All right, give it to us, Mel.
I mean, we kind of had some nice discussion. I had a little brain break scheduled in there, but I wanted to tally up our scores and let you guys know what's going on. So right now we have Dan and Christy are tied with 2. Josh, you got 1. Ed has not made it on the board yet this game. So our champion here did not do his studying over the last couple weeks.
Well, how you start, that's how you finish.
That's right. And you got to watch out for Ed. He's got all those letters after his name. He'll hustle you. He'll feed you a lot of line, and then you just hook yourself. Got to be careful.
All right. You guys want to keep push ahead?
Absolutely.
Move on to number 4.
Imagine a practice where patient engagement is seamless and unified. With trust-driven care, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. Trust-driven care is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up. Now, back to the show.
All right, question number 4. The article is titled Teaching Patient-Centered Communication Skills. a telephone follow-up curriculum for medical students. This was written by George Saba in the Journal of Medical Education Online in 2014.
See, if it was written in 2024, it would be Teaching Patient-Centered Communication Skills, a TikTok follow-up curriculum for medical students.
Yes. This article is actually it was interesting to read. So there were a couple groups of medical students, and they had they're in their residencies. So they're like, I guess technically graduated, but in the residency phase where they were doing, some of the students were following up. It was 1 week after the visit, and they were in all different kinds of care. So they had some in the hospital care, some in like office setting type care. But then there was another group that didn't do any follow-ups. So they kind of found out like what patients liked, how it worked, whether following up a week later was helpful or not. And it was nice because it was the doctor that was calling the patient. So the students themselves got kind of an eye-opening experience versus just having the front desk staff call.
So it was the person that treated them, aka the medical resident, was also the person making the phone call?
Yes.
Okay.
Yeah. So it wasn't just like front desk staff like calling and be like, hey, how are you doing? Anything new?
Yeah.
It was the actual, doctor that they saw called in to follow up. So your question here is, in the group of medical students that followed up with their patients via phone call 1 week later, what was the percentage of patients who did not adhere to the doctor's orders? So we're looking at compliance here. And I did not give you multiple choice on purpose because I'm kind of curious to see where these numbers go. I will be generous and give you a 10% leeway on either side. So 10% more, 10% less.
And we're looking for who did not adhere to the orders.
Yeah. So in the group that called their patients the week after, so they called after and they asked them like, how are you doing? What do you remember? Are you doing what I told you to do? Are you taking the medications I asked you to? Like things like that. So what was the percentage of patients that 1 week later, 1 week after the visit, did not adhere to those orders? And you have 5 seconds.
And you're looking for a number.
Yes. Percentage number.
All right.
For time.
Christy, you just hold up the letter B. I thought you put up B. I was like, that's not an option.
All right. Let's see. Christy jumped right up there. Did you have 35? I think I saw 35. Ed's got 35 too. Wow, that was a good number. Josh got 25 and Dan 60. Okay, so Dan 60, not many people are complying.
I would hesitate to use the word compliance because I think there's so many different reasons they might not be able to follow up. They didn't get the pharmacy was closed, the kid got sick, the dog died, whatever. There's just so much stuff that gets in the way. They didn't remember. They didn't really understand. I just think this is probably going to be a bigger number than you might want it to be.
But remember, this was a phone survey. So it's like, hey, did you do your exercises?
Oh,
absolutely. I did it 3 times today and 5 times yesterday.
Right now. Yeah, I was gonna put 50%, and then I realized, they're lying. So
yeah, I talked myself down from 60 as well.
You say, Ed, you're usually my like total outlier. You'll give me 80 or 10.
Right.
I'm your outlier this time.
Yeah. All right, you guys ready? It was 38%.
Yeah, girl.
That means I missed it by 3%.
There's power, right?
Yeah. That's as soon as Ed, I think I saw yours first. I was like, man, right on. Okay, so Josh, you are outside of that 10-point window. Dan, you're quite outside of that window too.
Well outside. A couple standard deviations away.
We're
Yeah.
gonna
I did it in a recount though. Those people are lying.
Yeah.
That study was definitely interesting too. And I chose that 38% because that was like the highest percentage of the kind of like parameters that they were looking at. So yeah.
Did it happen to say what the
interesting.
percentage who did not adhere if they didn't get a phone call?
No. So because how would you know? They didn't follow up.
Oh, I guess that's correct.
They've been included.
Oh, I guess we could ask depend on what it is. If it's like a simple medication, you need an antibiotic because you got a roaring fricking infection that's properly diagnosed, Dan.
Thank you.
Then I feel like that compliance is going to be a lot higher versus when we give people exercises and they're like, it's just interesting. And I wonder if you called them in 2 days or 1 day versus a week, like is a week too long? because I leave a video message for new patients on the same day.
Yeah.
Sometimes too early or not. It'd be interesting to see if there's any data on that. Like when's a good time to follow up with a patient. But
Melanie, call your friends at the Journal of Internet Medical Research or whatever, and let's get some movement here.
Definitely is the reason why we have things at the office to send people home with, like foam rollers and lacrosse balls and things like that. Because in the past, we show somebody an exercise that, hey, I don't have a lacrosse ball, but I'll pick one up at the store on my way home. Great. And then they come back, use little craft balls. Oh, I was going to get it. And they just don't have it. So then there's another week of no progress. Mm-hmm. And so we just make a point of having those right there. We give them to them at cost, but at least then they've got them. They go home with them and they're starting to make progress right away, because this is really a legitimate problem.
And I don't know if you see this too, Dan, but I've always thought that's one of the reasons the foam roller is so effective is it's weird. It catches your eye. It sits out. Whereas a ball, you could throw it in a bag and hide it. You know, a 3-foot foam roller doesn't fit in any bag I know of. And like, it's odd. But the uptake, especially in like older guys, the uptake of the foam roller is surprisingly high for something that, you know, if you're 68 years old with multiple surgeries, even if you're bathed in scotch, which many of them are, it's still uncomfortable to roll on that foam roller, but yet they're willing to do it like crazy. It's always shocked me.
Because it works.
Yeah.
And going back just a little bit, Ed, to your point about like studies on the timing of like when, you know, the phone call is important or the text message is important, I'll have to bring it up maybe next week. I do have an article that was texting with kids having tonsillectomy, and it was the parents getting messages before care and then after care. And it was kind of like that, where there's a text like 8 hours after, and then there was a text the next morning and the next evening, and then it was like 4 days after that. But yeah, I'll have to bring that one next week and kind of show you what the results of that were.
Yeah, that would be cool to see that data. Especially, I'm sure 2014 is different than 2000.
Huge. So much change in the last 10 years.
Yeah.
Yeah.
Well,
your daughters won't even pick up the phone, right, Christy? It's like,
no,
it's making a strange sound. It's like a ringing tone or something. It's weird.
Well, and the phone is never on, right? It's always on silent.
Yep.
All right, let's move on to number 5 here. The article for question number 5 is effective communication and resolution program on hospitals' malpractice claims and costs. So this study showed if they put a communication and resolution program in place, did the malpractice claims and costs go up? Did they go down? What happened? Your question is similar to that. Communication and resolution programs have been found to A, decrease malpractice claims, B, increase in defense costs, or C, increase in malpractice claims.
So you can't reduce the number of a-hole surgeons in your hospital, but you just introduce a communication strategy.
Communication. And I found this to be kind of about apologies again.
Just going to say that. It sounds like that one all over again.
Yes. So communicating with the patient, if something went wrong, you're communicating and resolving the issue. Or at least the hospital was trying to find these cases where there was a communication error in how they can fix it. But yeah, so did it decrease malpractice claims? Did it increase the defense costs of the hospitals, or did it increase the malpractice claims?
Which is interesting, because your malpractice care, at least mine, has always said, never, ever apologize, because it's like admittance of guilt. And that makes me think it might be B, that if they introduce this and people start apologizing, did it increase the cost of attorneys? But I went with A.
Okay. Then Ed got A, Josh got A, Christy got A, and Dan got A. Well, it would be a problem if you guys were all wrong. Everybody is on the board.
Yeah.
A.
But yes, essentially, if you're going to put a program in place where you're going to say, basically make it right, your malpractice is going to decrease, because the patients are like, oh, well, if they made it right and I feel better about it, they're less likely to put in that claim.
The tough thing is, like in a hospital-based like malpractice situation, some of that is like wrongful death, right? Like, hey, my mom died, I'm going to sue you.
That's what I was
So-
going to say.
How do you resolve that?
When I was in the hospital, I was in labor and delivery, and any bad case is terrible. So that's Josh, like what you're saying. You don't apologize because, I mean, not me personally, but from like the OB side, they're not going to apologize if somebody thinks that their baby died because of a ruptured placenta or a cord prolapse or something that can happen. We're human bodies and they do wacky things, but it was such high litigation. That's why I left the area, even though I loved it, is just because like you can't really protect yourself in an area where it's so tragic and so emotionally charged because, but people are going to sue.
My question is, they're going to sue anyways. Yeah. And even if you apologized, I always wonder about things like this. There's situations like, when you go into hospital and say, I have the worst headache of my life, you're going to get a CT scan, even though they're like, the likelihood of brain bleed is very low. Like, so could you reduce that? But they're like, it's so bad that if you miss it, it's a problem. I'm wondering, in these cases, if that doctor did apologize, does that really, in the end, net out a negative effect? Well, because I would think that you're apologizing and offering empathy, at some point, you're going to get less lawsuits, which affect the thing. Right?
Well, I don't think this says that the doctor apologized, though. This is just saying communication and resolution, right? So that might be the hospital saying, listen, we're very sorry that this happened. We're not claiming anything. We have a fund for this to try to make it right, although no monetary reimbursement. You don't have to wait for it. We can just, and they have a number, whatever that number is, 25 grand, 50 grand. They know that if they pay that up front and they have a resolution program, it's going to save the hospital a lot of money. Now, I don't know what that's true or not. That's just the way I'm seeing it.
Yeah. And I'm not saying about this. I'm about this specific study. What I'm just saying is this idea in healthcare, like never apologize. I wonder if that's like shooting yourself in the foot, because for that person that's waiting for you to apologize, it's like you're waiting for that politician to apologize. When they never agree, you're like, all right, fine. Then I'm going to get even with you. I'm going to get my pound of flesh for your lack of ability to say that you're sorry that I lost my kid, So
yeah, I think it's interesting too that we're, by and large, private practitioners or people that woulda, coulda, versus if I'm a doctor in a hospital, I'm an employee with layer upon layer of bureaucracy over my head. And so if I make a mistake, I am self-employed. It's up to me to apologize to my customer that I somehow made a mistake on. If I'm a doc in a hospital, I don't know how many layers above me, many of whom will be lawyers, are going to tell me, like, well, never apologize. It is our policy. It's a corporate policy. It's not an act of humanity anymore, right? So I think if you're a private practitioner and something like that, you act as your heart would give you the judgment to act. Whereas if I'm part of a giant entity, I don't get to use my heart because I'm an employee and I have to do what I'm told.
Yeah. Great point. And you just made me think of another interesting point, Dan, too, is in a hospital setting, like in private practice, you are responsible for what you did. And really, you might have an assistant. If a surgeon opens a can of worms, like apologizing, does that mean that, well, then the nurses also are liable, and then the charge nurse, and then the administrators, and then the,
all the layers,
radiology, and it just opens up everybody. Yeah. Anyways, tough one.
Shop small.
That's right.
Well, yeah, it was very helpful, Christy, to kind of pull out that information from a hospital setting, because personally, I haven't worked. I volunteered in a hospital, but I've never been employed in a hospital setting. So interesting to see from that perspective.
Well, and I think Josh is right. I think most humans, if we acknowledge the situation, even without making ourselves culpable for it, if we just acknowledge like whatever, and we try to do what we can to, there's no way you can write situations like that, but acknowledge what went wrong and, put our heart out to them as humans, right? Connect that, like the very first question, connect with them on a human basis. I think that overall, or maybe over a 20-year practice, that probably would decrease your malpractice claims. However, when you are part of a big managed care system, that's not always your call. And the other thing, the practical side of it is that like you have your legal protection, you have your own malpractice, but you also have your legal protection through the hospital. So if there's something that goes down, like somebody else brought up, everyone's going to get involved. Everyone's going to have their name on that lawsuit. And if you're kind of going rogue, yes, you are putting other people at risk, and not only risking your protection from the hospital legally, but maybe other people's as well. So I think that's where it gets kind of dicey to just kind of like wrap all of that kind of stuff up.
Yeah. Well, it's a tough one.
Interesting. Things I hadn't thought about,
Yeah.
working in a small office or practice. All right. You
And
guys
also
ready?
the stakes in what we do as chiropractors are fairly low. Like when Christy said like somebody loses their kid upon delivery, like that's a different galaxy of emotional, load and stuff versus.
But the reality
Back
is
to
that
first.
happens every week on any unit in every hospital, so just
Yeah, no, I'm saying like if you come in with back pain and I don't resolve your back pain, like we're not talking about height-based poker compared to what you're talking about.
right.
Mhm.
Yeah. All right.
You guys, you guys got one more question. All right. Question number 6. The title of this article is The Use of Mobile Apps in SMS text or messaging as Physical and Mental Health Intervention. It's a systematic review. So this was written by Amy Rathbone in the and it was published in the Journal of Medical Internet Research. I'm telling you, I'm like very excited about this journal I found. And this is from 2017. Okay, and your question is true or false? There was a linear correlation between patients who used mobile apps and or SMS texting and improved compliance. So this, a little bit of background on this article while you're looking at this, was that they looked at people that used like a Fitbit, that used a smartwatch, or that used an app, that like food.gov has like an app for, MyFitnessPal, yeah, all that kind of stuff. Were they more compliant? Did it actually improve compliance, or are people not really using them? If you're using them, do they work essentially in compliance? True or false?
Was there a time period?
Oh, that's a good question.
Like over a 6-week period or 6 months or?
I believe there was.
They tracked it from January 1st until January 3rd.
Yeah.
So very high compliance ratio.
I want to say it was 6 weeks, and a good amount of the participants were postpartum women.
Oh, interesting.
So if that
Specialized population.
Yes.
And Melanie, were they immediate postpartum or is this like, 6 months postpartum, blah, blah, blah?
The first 6
Josh
weeks.
coming at me with the full demographic of this article right now. I'd have to bring it up. I'd have to look it up for you.
Well, then if I lose, we cannot hold that to be a truth.
It's on me.
But yeah, that's...
All right. I'll bring you guys a full, maybe I should just read the abstract each week.
Allowed on the podcast. Super exciting stuff.
It turns into a 2-hour podcast instead.
Yeah.
Okay. Well, let's see what you guys thought. True or false? So let's see. Okay, Ed's got true, Christy's got true, Dan's got true, Josh with the false.
Well, it says linear correlation, and I'm wondering, was there like a, what's that called? Exponential or parabolic relationship? Like, did it drastically improve things?
It's true. This was way more simple than that, Josh. This is a very simple.
Josh is worried about the shape of the curve.
Yes, it was. If you actually use the app, so if I'm using a Fitbit, I was primarily what they used. If they're using a Fitbit or a pedometer, are they more likely to, get their 6,000, 10,000 steps, whatever their goal was? Are they more likely to use it than people who weren't using any sort of app? And they found that people that use the app tend to be more compliant with it because they have to think like, oh yeah, today let me put it in, or let me check my watch, or it gives them that thought process. Well, if you're not using any sort of device or watch or something like that, and you may be an active person, but you would not know that you got your 10,000 steps. But somebody that may be struggling with weight or struggling with compliance, like really wants to get X amount of steps a day. And this is a way to tell that person like, yes, you did it. You met your goal. You surpassed your goal. Or if you didn't make your goal, it gives you kind of the motivation to try.
People really dig into those things.
Oh, yeah.
The other day, I was asking about how he was sleeping. And he said, I slept great, but it really pissed me off. I forgot to put my Oura ring on. And so he got a great night's sleep that didn't show up on his app. So it kind of didn't count. It was funny. He has his best night's sleep ever. And he has no idea what his physiology was doing that day. So people,
I remember we used to host a run group out of our office, and there was like a subsection of runners who would get back and their watch would read like, 6.98 miles. And so they'd just be like running back and forth in the parking lot until their GPS broke 7.00. Like it's 6.98 is not, that's not a 7-mile run. That should have been my first clue not to work with runners.
I just gave my Apple Watch to my daughter because I was too competitive with myself about it. Like, it would irritate me if the same sort of thing, if it didn't track right or if I left it off. So I'm like, you know what? I'm doing this for the love of movement, for the love of whatever, being outside. I cannot track it.
Yeah.
Mm-hmm. I am definitely guilty. I need, like my Samsung, I need to reach all 3 of my goals every day, and it throws you a party. Even I told Josh earlier today that like my exercise compliance over the last like few weeks or so has been just awesome. I'm like, I feel so great. I'm like, well, it's my watch celebrating me every day.
We've all become Pavlov's dog as long as you have
Yes.
this little thing on your screen.
Wow.
I guess there are worse things,
Yeah.
Yeah.
Well, that was a fun week. Christy, you are our winner. You on the new on the show and just jumped right in and took over, huh?
What was our final score?
You're not. Ed's kicking you out. Christy, where would you love your donation to go to?
Ooh. Let's see.
So just so you know, it could be like a university that you believe in, like the research, or a nursing school, or your like California State Association of Nurses, or American
Can I
Association
do the
of Nurses.
cystic fibrosis?
Are they doing research?
Yeah.
Then yes.
Okay.
Cool. Is that cystic fibrosis like of America or something?
It's like the CF Foundation. I can send you the information.
That'd be great. All right.
It's awesome.
Fantastic.
I'd like to thank our guests for being on the podcast this week, for giving us some banter and some good conversation and keeping it entertaining. I'd also like to thank our listeners for joining us. And everybody, you guys can have an awesome night.
Thank you.
Thanks. This was fun.
Thanks for tuning in to this episode of Trust Driven Trivia, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Join us next week for more laughs, new guests, and fresh questions that turn medical research into pure fun. Trust Driven Trivia, making healthcare knowledge exciting, one question at a time.